actress Hilary Swank shocked a lot of people when she recently announced that she's pregnant with twins at the age of 48. So doctors say a healthy pregnancy at that age or even later is possible, but it can be difficult. So joining us now to talk about this is Dr. Monique Jones. She's the Associate Chief of Labor and Delivery at the Long Island Jewish Medical Center. Thank you and welcome to the show.
Thank you.
All right, so Dr. Jones, we don't know the specific circumstances surrounding Swank's pregnancy, but is it unusual for someone in their late 40s or early 50s to get pregnant naturally?
Yes, it's a little bit more challenging because, again, as we get older, our egg quality and our quantities continue to decline. And that makes it so much harder to conceive because our ovulation does decrease.
Okay, so if a woman is actually going through menopause or perimenopause, can she still get pregnant naturally?
Yes, but it is rare because, as I said before, the chances of ovulating as you're going through perimenopausal decreases down because of your egg production being so low.
Can you expand a little bit on that, just the effects that age has on your fertility?
Absolutely. So again, as we're born with millions and millions of eggs. However, as we get older and we go through our menstrual cycles, we tend to lose eggs as we continue to have monthly menstruation. So as we start to reach our menopausal or perimenopausal states, our eggs are so much lower in quantity and the quality of those eggs, because again, they start off from before birth. Those quality of those eggs are not as great or strong as they were when you were much younger. So therefore, it puts you at higher risk for having somebody who, a neonate or a baby that may have chromosomal abnormalities because those egg qualities are not good.
Okay, so Dr. Jones, let's talk a little bit about the risks that come with carrying a baby later on in life for both the mom as well as the child.
Absolutely. So there are risk factors, as you just said, for both mom and for the babies. Some of those risk factors, because we are getting older, are increased risk for high blood pressure. Okay, diabetes, something that's called preeclampsia, which is a type of blood pressure that also affects other end organ like your kidneys. Labor dystocia, and what I mean by that is the fact that your labor pattern may not go as well as you would like it to, just because of older age. And there are times that it may put you at risk for requiring a cesarean delivery.
So are there any ways? Go ahead.
Sorry. It's also found that sometimes because of these conditions, patients may need to deliver prematurely because of some of these increased risk factors. And that makes it sometimes more difficult to go toward the neonatal complications that can happen, which is a preterm birth. Also, babies having to stay in the intensive care for a longer period of time because they're born prematurely due to some of these comorbidities and cofactors that advanced maternal age may lead to. And as I stated earlier, when you have babies that are born prematurely, they're at a lower birth rate. So they tend to spend a longer time in the intensive care unit requiring higher level of care.
So doctor, are there any ways to kind of lessen the risk or avoid health problems?
So yes, I always tell any patient, whether we're young or even if we're older, that it's so important to have good nutrition, that it is so important that you exercise so that you can have great stamina when that time comes in for labor. Some of the recommendations that we recommend in patients of advanced maternal age is to take a baby aspirin, because we found the use of baby aspirin decreases down the risk for preeclampsia. So just proper health, nutrition, getting great sleep, and exercising is extremely important for all patients at any age, but especially for our advanced maternal age moms.
So doctor, if someone is in their late 40s or early 50s and wants to conceive naturally for the first time, what advice would you give them?
So I would tell them that they need to reach out to their doctor, their obstetrician, very early, and that they should have a plan. And also, besides reaching out to their obstetrician, it should be done in conjunction with a high-risk specialist that we call a maternal fetal medicine specialist, working in collaboration with your obstetrician so that we make sure that you have the best care possible.
All right. Well, Dr. Jones, thank you so much for joining us today.
Thank you for having me today.